Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm Logan Plaster with my guest here, Chris Turner with HealthBook Plus. Chris, great to see you today.
You too, Logan.
All right. HealthBook Plus has the distinction of being one of the newest members of the Startup Health family. We're still getting to know all about your team and what you do. So introduce to our audience what HealthBook Plus is.
Excellent. Hi, audience. So HealthBook Plus, what we do is we help people own their health by leveraging data and AI to get to their next best health action.
How'd you get into this?
But it's a crazy story. It's all started in Greece.
Okay.
Most people don't expect that, but ran into my friend Dr. Sakopoulos, who's a GI doctor, and he's got a friend named Stathis who owns a shipping company. And the problem those two guys were trying to solve is the people on the ships, for Stathis' ships, are typically Filipino. The captains are Ukrainian, and Stathis really cares about his people. And the only health information that they have on an individual is a pre-boarding physical.
Okay.
So if you're in the middle of the ocean and something happens to the seafarer, this is crazy. The seafarer tells the captain sends an email to a doctor on land. The doctor on land looks at the pre-boarding physical, sends an email back to the captain. Captain has to try to diagnose what's going on with the individual, and you could tell that's probably a very bad situation.
Yeah.
Oftentimes the ship gets diverted. When the ship gets diverted, it typically costs the ship owners about $1 million.
Wow.
It's a big problem.
So talk about the cost. I've talked to other people about the cost of a hospitalization. That's high.
Right.
This takes it to another level.
And then the cost of hospitalization on top of that when they get to port.
Sure.
So anyway, so what we came up with is this health record, because there's no EHRs in Greece. And then I met these guys, and I'm like, well, that's really cool, but other companies have done that in the US. It always fails. But if we can add a lot more data to it and an AI-driven predictive analytics engine, then we really have something here. We can help people own their health.
Far beyond the ships in Greece.
Right.
Okay. So HealthBook Plus, what was your background in this?
So my background, I've been in healthcare for a really long time, everything from pharmaceutical company to startups like HealthGrades, eVariant, and Medici, where I ran the commercial side of things.
Gotcha, okay. So what was your vision to take something that was for these employees out in Greece and say, this is something that we can use to help folks? Are you in the United States now?
Yep, we're in the United States.
Okay, so what was your vision for helping patients here?
Yeah, so really it was that in the Cures Act, Open Notes component very specifically, now patients have access to their health information digitally.
Sure.
So it's much easier to grab that data. So I'm like, hey, if we can connect to EHRs and connect to payers, connect to your wearable, and also bring in socioeconomic data, we can have the best picture of an individual from a data perspective.
Gotcha.
And then those people can share it with their family, share it with their provider. They can choose what parts to share, what parts not to share, and ultimately take control. But most people don't know how to take control of their health.
Gotcha.
So we built an AI tool to help them understand and guide them to what that next best health action should be.
Okay. You mentioned some big ideas there, like integrating into an EHR, integrating into the person's life. Those are challenging. What gives you the marketability to do that?
Well, part of it are partners.
Okay.
We jump on some partners that have the plumbing into the EHR, so we can grab that data a little easier. But we've also built some direct integrations, and we'll continue to build those integrations. Yeah,
it sounds like your background kind of eased that road.
Right.
Yeah.
Exactly, and we have an amazing team. We've got some physicians on our team. Our chief data officer is a PhD MD that's been building models like this for the last 20 years and working specifically on individual models for the last 8 years. So our platform, we've been able to identify 100 conditions that we can do from a pure preventative standpoint. So that would be things like you might have cancer in 10 years, or you might have a cardiac disease in the next 3 years, or possibly if you're pregnant, you might have a high-risk pregnancy and a possibility of having a NICU baby. Yeah. And then we can direct those people to an early intervention. The other component of the AI is really more of an acute type of thing, like I have a headache, my child has ear pain, I'm feeling nauseous, I'm feeling stressed, and they can put that into HealthBook Plus. The instant health check will ask a few questions back and forth, and ultimately give possible conditions and, more importantly, a triage directive. And we've been able to identify that people said that they were going to go to the emergency room before taking the instant health check.
Yep.
ultimately 30 to 50% of the time got redirected to home care or telemedicine.
Gotcha, which we can directly tie to cost savings.
Yeah, and improvement in care.
Yep.
Right?
Just improvement in patient experience.
Well, exactly.
One of the things that fascinated me about the first time that we met was talking about different streams of data that you're pulling in that might not be traditionally thought of as adding to a person's health picture. So tell me about that.
Right. I mean, the whole socioeconomic component, one of the things that was really cool when I was at eVariant, we leveraged the consumer data to help hospitals understand who in their primary or secondary service area be at risk for any particular disease state. So I knew, hey, we can leverage that data for an individual as well.
Give me an example.
So an example would be people that quit paying their cell phone typically have some type of challenge with their health, could be mental health challenge or others, but we don't take it just from a single, one thing, right? They didn't pay their cell phone bill. But when you aggregate it all together, like I bought a new car versus a used car, I shop at Target versus I shop at Walmart, all those different things come together to where we can build really specific models to help people understand, hey, you might be at risk for this from like a high, medium, and low perspective.
Got it. So really creating a predictive engine and not just an analytical engine.
You got it.
Got it. Okay, so what are you most excited about 2023? I know that the business is early, so what are your objectives right now?
Yeah, super early. We just launched our platform 2 days ago.
Congratulations.
We're ready to go for Vive.
Awesome.
We've also built some really engaging technologies for people to engage with our platform, like a digital human that is backed by conversational AI.
What do you mean by that? Digital human?
Just what it is, digital human. She's amazing. Her name's
Avatar.
Surya. Yep. She looks very identical to human, but what's most impactful is she uses the camera to see what people's facial expressions are.
Oh, okay.
And so she can adjust her tone, her facial expressions to what's going on with the individual. So instead of that transaction for health being transactional, right? Now it's more empathetic. So if one of the questions, say, is something might be embarrassing or something that people typically wouldn't talk to or want to talk to their doctor, Surya can actually take a pause, change the tone in her voice and be way more empathetic to the individual. Like, hey, the reason why we need to ask this type of question is to really get you to your best health.
Interesting. I've been talking to founders over the last couple of days who do what they call below the belt health. People working with, or IBS. There's all sorts of stigmatized care where this could be useful. I know it's early. Any feedback so far to that process?
Yeah, people love it. So far, at our booth, people have stopped by, tried her out, and they're like, this is really amazing, like how she's so engaging and comforting and that.
And you said the avatar is using the camera to actually read your facial expressions.
That's right.
Okay, and understand kind of who's an ideal partner for you? Who are you looking to work with?
Yeah, so health systems, we really want to help health systems with their employees' mental health.
Okay.
There's such a stigma associated with mental health and any type of healthcare practice. And so we want to help those folks go through HealthBook Plus, and then if they're struggling, connect them with a peer coach or a counselor.
Got it. What are you most excited about 2023?
Helping people. That's really our thing, is like we're so excited to get people on the platform and be able to get people to their best health leveraging our technology.
Awesome. Chris, thanks so much for joining us. It's exciting that you're part of the Startup Health family. It's going to be great to see how you grow this year.
Cool. Logan, thanks, son.
All right.
All right. Appreciate it.